Good day from Pretoria, South Africa. I am sending this message from my home, where we still have a lockdown in South Africa. The restrictions have reduced somewhat, and we are currently on level 3. But this has had an impact on the work of CABRI. And speaking of COVID-19, with the exception of South Africa and Egypt, infections in Africa have remained low relatively to other regions. Although this may still change, the quick actions and the application of known methods of curbing infections may still save the continent from a crisis that could overwhelm healthcare services and public finances. However, these measures to curb the rapid rise in infections, such as the hard lockdowns and the resultant slowdown in global output, this has had a devastating effect on African economies and public finances. Despite shrinking revenues, African governments have taken extraordinary measures in their response to the pandemic. Some of these measures have included monetary and fiscal policy changes, budgetary prioritization, and support to vulnerable households. Some of the common budgetary responses have included reprioritization to bolster health expenditure. We've also seen countries stalling capital expenditures, and also all countries accessing emergency funding from international financial institutions. Mozambique and Angola, for example, increased health expenditures by 30 million and 40 million US dollars respectively. Senegal cut its operating budget, it deferred investments, and allocated 107 million US dollars towards COVID-19 expenditures. These are just some of the measures taken by African governments. For more information in this regard, please visit our COVID-19 Managing Budgetary Pressures in Africa, and also the Public Finance Response Monitor, and both of these can be found on the CABRI Knowledge Hub. Travel restrictions across Africa that are still in place have resulted in a change in the way that CABRI works. Our approaches to peer learning and building capabilities had to transition to an online format. Since the lockdown, we have hosted 2 webinars on managing the budgetary pressures to COVID-19, as well as a webinar on strategic health purchasing. We also used the webinar format to launch the report on public health budget practices and procedures in Africa. Future online workshops with member countries and also participating countries will cover public debt and information systems in public finance. The 4th edition of the Building Public Finance Capabilities program has gone almost entirely online, with CABRI coaches conducting framing workshops and check-ins with teams of country officials using a combination of software packages. The CABRI Secretariat will continue working from their homes for the foreseeable future, depending on South Africa's COVID-19 risk-adjusted strategy. But we will ensure that through the use of online technology, we effectively collaborate and service the needs of our members and participating countries. I certainly look forward to the day when we are all able to meet again face-to-face at one of the many CABRI events. Thank you very much.